Hi guys, Ralph Kohl here, your Senior Director of Federal Government Affairs in the AANA DC offices. In preparation for our mid-year assembly 2017, I wanted to provide you with some updates on the issues that we would be working on and cover some of the talking points that we'll be discussing when we come to Capitol Hill to advocate on behalf of this wonderful profession. One of the issues that we'll be focusing on during our Hill visits this year is the critical role that CRNAs play in the provision of the highest quality care in rural America. Rural hospitals are struggling and critical hospitals are closing in an alarming number. In the vast majority of rural counties, CRNAs are the sole anesthesia providers. Ultimately, CRNAs are critical pieces in the ability of our healthcare delivery system to meet the demands of rural America. In support of CRNA's role, we are going to be supporting the Critical Access and Rural Equity Act, the CARE Act. It was introduced in the last Congress by Representatives Harper and Loebsack. Myself and J.P. Mason on staff have already met with Representative Harper about reintroduction during this Congress. They're actively working to have this introduced prior to our arrival here in D.C. For mid-year assembly. So we're hopeful that we'll have a bill number prior to your arrival here. If we do not, when you're in your meetings, let them know that this legislation, which was introduced during last Congress, is poised for reintroduction shortly, and that once it is reintroduced, that they should co-sponsor this legislation. One of the provisions that's really important to CRNAs in particular is the restoration of on-call payments in critical and rural hospitals. This is essential to basically ensure that these hospitals have adequate coverage by CRNAs to meet the demands of rural America. Other legislation specifically pertaining to rural health, and one that we've seen introduced and reintroduced Congress after Congress, is the Medicare Access to Rural Anesthesiology Act. This is introduced by Representative Lynn Jenkins, a Republican from Kansas, every year. It essentially introduces additional costs into the Medicare program without improving access or outcomes. This is specifically related to the Medicare Part A Rural Pass-Through Program. This is a program that was started several years ago for those hospitals that did not have enough Medicare Part B billing to justify an anesthesia provider within those facilities. The pass-through program was created to allow these facilities who had 800 cases or less to pass Part A dollars for the reasonable cost of a CRNA, to essentially ensure that they had access to the anesthesia care that's critical to obstetrics, trauma stabilization, and the like in rural communities. This legislation would allow anesthesiologists access to this program, which up until this point has been specific to CRNAs. And as you know, introducing anesthesiologists would introduce additional costs without improving access or outcomes, which is antithesis to where we want to be going as a delivery system, where Medicare wants to be going. Anything that's going to increase costs without improving quality or access should be dead in the water, and we'll be pushing hard to make sure that Lynn Jenkins' legislation is once again dead in the water upon introduction. Thank you so much for your time. Please don't hesitate to contact me with any questions, comments, or concerns. Have a great day, and I look forward to seeing you here at midyear.